Many women in menopause report symptoms of moodiness and depressed mood. A recent randomised control trial used the Oxford Happiness Questionnaire to assess the effects of saffron on happiness in postmenopausal women. So we thought we'd ask Dr. Paulo to come in and discuss this study with us. Paulo, what are the causes of menopausal moodiness, depression, or what they call menopausal blues, in fact?
Well, you could split them into two groups, the non-physical and the physical. So the non-physical would include one's lifestyle, accumulation of emotional baggage over one's lifetime as well, your identity crisis that you may face at that time. Who are you? Future expectations will also play a role, okay? And then internal ones obviously have to do with the functioning of the body. So steroid hormone imbalances, that includes progesterone, DHEA, testosterone, and estrogen that can occur at that time. Okay. Also, low-grade chronic inflammation plays a role. The production and effect of neurotransmitters may also be affected. If by that time the woman has already developed some chronic condition and is on chronic medication for it, the side effects of the medication could be a contributory factor. Right. And also, if women have already started taking antidepressants for a period of time, for an extended period prior to reaching menopause, the side effects of long-term antidepressants can actually cause rebound depression. So all of these factors combined could contribute to menopausal blues.
Now, Paulo, for this particular study, they've used the Oxford Happiness Questionnaire. What exactly is that?
All right, so this is a questionnaire that was developed in 2002 by psychiatrists at the Oxford University in the UK. It's basically a measurement of psychological wellness or well-being. It is a set of 29 statements, and you have to read them and then respond and grade them from 1 to 6, basically where you strongly disagree all the way to strongly agree. At the end, 12 of these scores are kind of reversed. So if you scored 1, you then change it to a 6 and so on. Okay. You add the values, divide by 29, and then the higher the value, the higher the level of happiness or psychological well-being.
Okay, so it's sort of a survey assessment of how you feel about life.
Yes, but it's a validated way of measuring such things, which we can't measure in blood, for example.
Yes, yes, absolutely. So now they use that along with people using saffron as a sort of a way to manage something. So how did this study, what did it show ultimately in the results?
All right, so there were two groups. One was the intervention group that was taking the saffron, and the other was the control group.
Right.
So the results were significant in that the intervention group had major improvements in the scores, whereas the control group had no improvement at all.
Okay.
For example, the so-called p-value, for those out there that understand the statistics, was less than 0.001. Now, P stands for probability, so it means that there was less than 1 in 1,000 chance that this was due to chance, so to speak. In other words, the differences between the two groups at the end had to be due to what was done to the intervention group.
Right.
In other words, saffron was shown to improve psychological well-being, as it has been shown in previous studies.
Okay. So now, Paulo, we've spoken about saffron before in various discussions, and definitely it's got a psychological impact.
Yes.
But let's just refresh for viewers what saffron actually is and why there's any implication.
All right, so saffron is primarily a spice. It's extracted from the stigmas of a plant known as Crocus sativus. And in cooking, for example, it's used for seasoning and as a coloring agent. It's used in paella and risotto. Those are two of the well-known dishes in which it is used. But in terms of health, traditionally it has been used for ailments of the eyes, the respiratory system, the gut, as well as the urinary system. A lot of the scientific research over the last decade or two has zoned in on its effects on depression and anxiety primarily.
Okay. Yeah. So what other studies are out there that focus on depression and anxiety, and what are they showing?
Well, specifically in terms of menopausal women, there is one in 2021 published in the Journal of Menopause Medicine. It was a randomized, double-blind, placebo-controlled study done the proper way, and over a period of 12 weeks, where one group was obviously given a placebo, the other group was given Efron. Efron is a specific extract of saffron, a standardized extract. And the other group was given Efron twice a day. So the results showed that what they did in this case is they did not just use one measuring tool, like the Oxford Happiness Questionnaire. They used 3 different measuring tools, all validated tools. And the results were that there was a 33% reduction in anxiety scores and a 32% reduction in depression scores. So again, it showed that saffron, specifically this Efron extract, was as effective as fluoxetine,
which is Prozac.
Prozac, correctly, as imipramine and citalopram, which are other antidepressants, without any side effects.
Okay. Now, Paulo, obviously, menopausal blues is not because a woman has a deficiency of saffron in their life.
Yeah.
So what is the saffron actually doing?
All right, so what has been found out in research is that it affects the production and effect of serotonin itself, all right? It has antioxidant and anti-inflammatory benefits in the areas where this would be required, because we know that inflammation and free radicals play a role in the development of depression and anxiety, especially in neural tissue. And so that has been found that those are some of the effects or some of the means by which Efron achieves its results.
Okay. Now, again, I mean, we've spoken before that there are certain mechanisms that are not fully understood. So it's not like you can say the saffron's going to do X, Y, and Z, and that is then changing.
Correct.
But it's fascinating that regardless, it works. There's scientific studies that show the impact of it.
Correct. So in many plant substances, as well as in pharmaceutical drugs, many of them, we know the effect, but we cannot always in detail explain how it achieves that effect. Okay. So, but we know that because the effect often is measurable in terms of body fluids, for example. We can measure the effect in blood of a substance, but we don't quite know how the substance achieved that effect in the human body.
Right. So, Paulo, we've put Felix with Efron into our Real Health Medicine cabinet this week, and you've spoken about Efron as that standardized supplement. Why would this be something to consider?
Okay, so Efron is a standardized extract of saffron, which contains 3.5% of the active compounds, which are called lacticrosalides. Okay. And so, which means that the amount of active compounds in each capsule, in this case, is exactly the same as in any other capsule.
Right.
So this is measurable, so you know that you are taking exactly the same thing. And this amount of active compounds is the amount that has been used in most of the research.
Okay.
So we know that this is the amount that achieves results. Because, for example, you could, if you can find it, take saffron tea. But then every cup of tea will contain different amounts of saffron. Okay. Not that you should not drink saffron tea. By all means, drink saffron tea. But this is, in terms of plant extracts, standardized extracts, means that every single capsule is deemed to have the same effect because we know exactly what is in the capsule. So this product contains Efron. Efron is produced in Spain. So the producers of Efron do not sell to the public as such. So they produce Efron and they sell to supplemental companies who then place it under their labels, as is the case here, and give it a name. And in this case, they've called it Felix. Okay. So it is, by the way, Efron has also been shown to modulate the production of cortisol, which is very important.
Right.
You know, stress levels in terms of depression and anxiety and the menopausal blues and the stress that a woman may encounter at that point in her life.
Yes.
So this effect of Efron is also relevant.
And I mean, if somebody is heading into that phase of menopause, I suppose you don't need to take it as a preventative something, but the minute somebody feels, okay, the moodiness, the blues, it's becoming noticeable, if they started to take a supplement like this, how long might it take to see a result? Or initially I'm sure it would just take the edge off.
Yes, look, so keep in mind that a saffron extract, as far as depression and anxiety is concerned, is not just for menopausal women. So anyone with depression and anxiety, because as I mentioned earlier, it has been shown to be as effective as certain antidepressants. Yes. So one could take it at any time.
Okay.
All right. So therefore, to answer your question, because it has no side effects, Okay, it can be taken at any time, but
Right.
remember also it has other effects besides its effects on psychological well-being.
Okay.
For example, we know that one of the classic side effects of antidepressants is sexual dysfunction in both men and women, including erectile dysfunction in men. And there has been research which shows that Efron or saffron standardized extracts have proven to reduce those sexual dysfunctions, to have a positive effect on them.
Right.
It also relieves PMS. So it has other effects. So there are other reasons for possibly considering to supplement with a saffron, a good saffron extract.
And what about, Paulo, people who are on some of these antidepressant medications? I mean, can they swap over to Felix or to a saffron supplement, or should that be something very much done in consultation with your practitioner?
So, firstly, these do not interact with the antidepressants in terms of a chemical interaction that is going to cause adverse problems.
Right.
But because they have an effect similar to the antidepressant, they would obviously it would obviously mean that one of them needs to be reduced if you were taking both.
Right.
Okay. So with taking antidepressants, it is a difficult area often to have discussions about, because in terms of general guidelines by the major psychiatric bodies in the world, in terms of medical bodies, 6 months is usually the maximum that an antidepressant should be taken for.
Okay.
Because in the meantime, the causes for the depression should be dealt with.
Right.
So if one becomes depressive because one lost his job, for example, naturally the antidepressant is not going to give anybody their job back.
Absolutely.
All right.
Yeah.
So we need to deal with the causes. So 6 months is usually the time period. And unfortunately, we see in our modern society, and you will know people who have been on antidepressants for years and years and years. So then the side effects change. In other words, you can get rebound depression. It becomes addictive. Your body builds tolerance to it, which means that 5 milligrams is no longer enough. Now you need 10 milligrams. So in a situation where this has been taken long term, then to come off an antidepressant, it must be done in the correct ways.
Right.
You've got to be weaned off. So the assistance of a knowledgeable health practitioner, a doctor who knows what he's doing, should be sought so that you can gradually wean yourself off the antidepressant.
Right.
So that's very important.
Okay. And Paulo, is there anybody who should be cautious of considering taking a saffron supplement, or is it quite safe?
Not really, unless you're allergic to paella or risotto.
Well, on that note, Paulo, thank you so much. Very interesting studies around saffron, and such a beautiful spice as
Yes.
well. So great to have you with us again.
Thank you.